Good morning. I'm Kenvet Mangum, and this is my presentation on the national opioid crisis. For my objectives, at the end of this lesson, the learner will be able to recall the most common abused opioids. They will be able to describe the national opioid crisis. They will know the signs and symptoms of opioid abuse and who to contact in order to get help. They will be able to recall any risk factors associated with opioid abuse. What are opioids? Opioids are substances that basically tricks the brain and the body into thinking that they need them in order to survive. Opioids work on the nervous system of the brain in order to control the intensity of pain within the body. There are many types of opioids. There are prescriptions, there are synthetic, and there are basically like narcotics type of opioids. The main ones that are commonly abused would be like methadone, oxycodone, hydrocodone, heroin, of course, and then a synthetic type would be fentanyl. So basically, the opioid crisis started between 1999 and to 2018, and between that time frame, approximately 450,000 people have died from an opioid overdose. Daily, there are 115 people who die from an overdose, and 1 in 4 patients struggling with opioid addiction usually end up going to heroin. Or most patients who use heroin, they have previously misused opioids. This is basically describing the three waves of the opioid epidemic. So in the 1990s, that's where we saw the increase of the opioid abuse. And then around like 2010, that's where we started seeing the high death rate that came from heroin. And as of like 2013, that's when we're seeing the death rate rise with fentanyl use. This is basically about some statistics. And so approximately 30% of patients who are prescribed opioids for chronic pain, they tend to misuse them, that meaning that they take them basically anytime they feel a type of pain, or some people take it for comfort, some people take it for sleep. Instead of taking it exactly as prescribed by the doctor, they tend to just use them. Or either people start sharing prescriptions or buying prescriptions. 12% of the patients who use opioids develop an opioid use disorder. And then it goes back to the 6% of the people who have an opioid use disorder, they tend to abuse heroin later on in life. This is basically a chart which just shows the numbers and the statistics as well. Risk factors. So risk factors that will lead to some people abusing opioids would be getting overlapping prescriptions, going from doctor to doctor, asking for pain medication prescriptions, or trying to shop around between pharmacies, get one filled this week and then going next week try to get another one filled. Patients who have chronic pain that's uncontrolled, it would be another risk factor. Taking high daily dosage of the medication instead of as prescribed. And then, of course, having like mental illnesses or previous substance abuse. The impact on the healthcare industry is basically the opioid sales has quadrupled since 1999. Emergency resources are often called out to like 911 calls due to opioid overdose or heroin overdose. Also, insurance rates has increased. Before prescribing opioids, we should, as healthcare providers, screen for high risk conditions, discuss other treatment options besides opioid use like acupuncture, therapy, repositioning, and oftentimes try to do those in between the dosage of an opioid. This is just some signs and symptoms of opioid abuse. So basically, loss of interest in activities, loss of finances, hanging with a new crowd of friends, and more. Making a difference. So we should basically start screening patients more for signs of abuse or drug-seeking behavior. Offer support to anyone who needs it. Anyone who's suffering from abuse, don't judge them, but offer support to them. Refer to the hotline or the clinics or recovery center that would be helpful. Any questions? The end. And this is reference.